Hi everyone, Dr. Leigh here from Your Vet Online, and welcome to today's tutorial. Today we're going to be talking all about laminitis in horses. And it's one of those tricky little topics. This time of year, spring has sprung, the days are warming up, and combined with all this rain that we're getting, it is the perfect conditions to grow grass, of course. And of course, with the abundance of grass growth, it's absolutely imperative and crucial that we act now to ensure that our ponies and those horses that are prone to laminitis are kept safe. So in this tutorial, we're just going to focus on some of the preventative strategies that you can take to help hopefully stop this from happening, and also how to treat it if it does occur. So those, in particular, the first aid treatments, so that you can have ponies that aren't in pain. Now, if you haven't met me before, I'm Dr. Leigh Davidson, and I've been a veterinarian for over 20 years, so we're getting on a bit now. And I run Your Vet Online, and we're Australia's first 24/7 telemedicine online vet consulting service. So you can get veterinary advice 24/7. Now, every Tuesday on either Facebook or our YouTube channel, we do hold these tutorials, and we have different topics each week. And at the first of the month, on the first Tuesday of each month, we let you have free for all, so you can ask any questions you like. But that doesn't mean you can't ask questions today. So if you do have a question you want to have answered regarding laminitis in your horses and ponies, please pop it in the comment section and I'll make sure to answer it probably at the end, because it's much easier then. All right, let's get right to it then. What exactly is laminitis? Well, laminitis is the term that we give for inflammation of the structures of the hoof wall, the structures that connect the hoof wall to the actual pedal bone. So I do have a little hoof with me here, and actually I do have a picture too, so we might just pop this one up. Okay, get myself in the camera here. Where's my foot? Yes, so we want to be looking at that region between the hoof wall, the outside here, and also the where it attaches to the bone. So if you can see that bright white area, that is the healthy lamina, and that's what it looks like. And that holds that hoof wall against the bone underneath. Now, we've also got, and actually I'll just preempt this with saying that if you are a little bit queasy, we do have some pictures here which you might find a little bit disturbing. So just be warned, there could be some in here that you might not like. So just be warned, they're not too bad. So in this picture, we can actually see this was a horse that actually did have laminitis. And so what you can see on the screen there of the picture with the underside of the hoof, you can see that the bone, you can just see that bit of redness, that's the bony column pushing down. And you can see the picture of the hoof with been removed from that bony column. You can actually see the lamina, and those are those little stripy sort of red areas, and that's actually the lamina. So that's what we're talking about when we talk about laminitis, and it's that connection between the pedal bone, which is sometimes called the coffin bone, sometimes just called P1, and the actual hoof wall. When that gets inflamed, that coffin bone can actually rotate and tip downwards, and pull apart from and making a gap between the hoof wall and that bone. The gap widens. Often we see that a lot of the signs, mainly in the front feet. It can also occur in the hind limbs. And we have to remember, this is a massive welfare issue. Just think of the last time you might have got your thumb, you hit it with a hammer, or you jammed it in the door. You know, it is so painful. And that's exactly what these horses are going through when they have a bout of laminitis. So it's absolutely imperative that you consider their welfare and you make sure that you're doing the right thing and treating them, and hopefully actually preventing it in the first place. So this just explains how we get that rotation. And we can see with the nice hoof wall on the right of your screen, you can see a little bit of gas, which is that lighter coloured area. That's actually because the lamina is starting to stretch, and it's starting to have gas pockets develop in that area. So that's a sure sign that we've got laminitis happening. Now, if we get onto what are the actual signs of laminitis, and I guess we all are quite aware of the pony or the horse that leans back onto its haunches and is terribly uncomfortable. This is probably the most recognizable sign, but what we actually want to make sure is that we recognize the subtle signs that your horse might be starting to suffer from laminitis. So it's incredibly important that you do learn to recognize these signs. And one of the first things that we do is we actually want to learn and recognize how to take a digital pulse. I tried to get a little video to show up on here, and unfortunately I failed. So you'll just have to look at this picture. But what we're doing is we're checking for a pulse in the region of the fetlock there. So when you run your hands down the side to the back of their back of their actual fetlock there, where the sesamoid bones are, if you run it sideways like so, oh, thanks, Belinda. That's lovely to hear. Thank you. When you push your fingers against that area and you just rub it slowly like that, you'll often feel 3 vessels, and that's the vein, artery, and nerve. And practice touching that area, push in quite firmly. I always say to push firmly and then slowly release until you feel the pulse develop. The thing is if you push too hard, you actually won't feel anything, because the pulse, you block off the blood pressure. So you've got to move backwards. And also just remember, never use your thumb, because your thumb has a pulse too. So you might be going, is it the horse or is it my thumb? So that's one of the first things that you can do daily. I'd actually recommend you do this daily with those ponies that are prone to laminitis at the moment, because it's one of those quick signs that you might notice first, rather than noticing subtle signs of lameness. So remember, some of those subtle signs of lameness could be, they look like they're walking on a hot tin roof, they're like picking their feet up a little bit funny. But often you don't, that's sort of down the line a little bit. Sometimes they're walking okay, but maybe they're just turning a little bit funny. So if you put them on a tight circle and you're turning them around yourself, you might just notice that they're a little bit ouchy and they move that head a little bit like this. So just if they're doing that, then definitely check their digital pulse and make sure that you can recognize whether that is bounding. So all horses have got a digital pulse, but when they have laminitis, it will bound and it will be like this big feeling. So make sure you check now, learn what normal is. Hopefully your horse doesn't have laminitis, And then you can recognize the signs when they potentially might be having a problem with laminitis. And of course, even if they might not actually have laminitis, they might have a hoof abscess. So this is one of those key things that it's a diagnostic tool that we have in our little kitty. It's easy. You don't need any assistance with it. You don't need to have anything else but your 2 fingers. So always check your horses with that. The other thing that you might notice, and again, this is something, you might just see it when they're grazing, is that they're just shifting weight a little bit. And that's a common sign right in the early times before they get too bad. And of course, we've got the rocking back on their haunches. And then, of course, they might be lying down more than usual. And so those are all the signs that your pony or your horse might actually have a problem. So what are the main causes of laminitis? Now, this talk I'm going to concentrate mainly on the endocrine causes, and those are things that are caused by your metabolic syndrome. So that's equine metabolic syndrome, and we're basically talking about insulin dysregulation when I'm talking about that. We also have other endocrine disorders such as PPID or Cushing's disease, and that can predispose to laminitic conditions and flare-ups, and that's all related to cortisol type issues. We've also got to realize that these endocrine conditions, particularly insulin dysregulation, is often related to grass, and that's why we have the problems with the little fat ponies and the ingestion of lush, rapidly growing grass at this time of year. The second type of cause we see with laminitis is that related to inflammation. And these are sort of our horses that are usually, they're usually not these ponies. They're usually, a horse. And when I'm talking about the ponies, I just mentioned it's usually those British type breeds, the Shetland ponies, the Welsh mountain pony, the Welsh cob, all those types of ponies are far more prone to laminitis than some of the other bigger horses, like your thoroughbreds and everything like that. Now, the inflammatory type cause of laminitis is often caused by things like gastrointestinal disease. So if your horse gets a really bad colic and maybe combined with sepsis, so they might have a strangulating colic, they might have severe diarrhea, perhaps a pneumonia, and also with breeding mares, like with our retained fetal membranes, that can actually lead to laminitis due to that sepsis process and that inflammatory mediator situation, which actually causes inflammation of that lamina. Now, also remember there's compensatory laminitis as well. And those are the conditions that we see when we have a really bad injury to our horse. So perhaps they've broken a leg, they've got a fractured, say, pedal bone or a fractured cannon or pastern, and they're confined, they're standing all day and they can't put weight on that foot, that leg. So they're putting all their weight on their other legs, and that causes a compensatory type, weight-bearing type laminitis. But in today's talk, we're just going to concentrate mainly on the ones related to endocrine disorders, because that's the one that we see particularly at this time of year. The predisposing factors for this type of laminitis, mainly equine metabolic syndrome, and that's just the fancy term for a horse that can't regulate its insulin. It's usually obese. As I said, we've got our British breeds, our cobs, our Welsh ponies, that sort of thing. So they are really, really, really high risk for this type of laminitis. Cushing's disease will often do it as well, as I said before. We've also got to remember that if a horse has had a previous bout of laminitis, they tend to be more prone to future bouts of laminitis. So always keep a really close eye on those guys. Also, any horse that has got poor hoof conformation, really long toe, heels that are really, really long, heels that have pushed forward, where the sole and the frog and everything is completely off the ground and there's no proper loading, that can be a predisposing factor to laminitis. And so it's incredibly important that we actually have regular consultations with our farrier, get them out. Some horses are going to need, at this time of year, 3 to 6 week trims. It's just a fact of life, and you're going to have to budget for it. It's just one of those things. And if you've got a small pony, these trims aren't necessarily too hard to actually learn how to do yourself. So that could be a way to get around, especially if your pony is needing lots and lots of trimming. Other risk factors, of course, obesity, and of course, inactivity. How many of us have ponies that sit in the paddock a lot, and maybe the child just rides it they might ride it every day, but how many of them actually work up a sweat? How many of those ponies are actually doing work that actually makes them work? So I would say there aren't too many. So we need to work on that, and I'll touch on that later. But a lot of them are very unfit. And also at this time of year, sometimes because the weather's suddenly improved, we also go out and we decide we want to ride them a bit more. And so the unfit horse is actually at risk of laminitis too. And also things like excessive concussion. So just be wary about riding your horse on really hard surfaces. I've gone to horses who've got out of the paddock, run down the road for kilometres and kilometres, and then they've all had laminitis, and that's because of that concussive type thing. How do we actually assess the risk of laminitis? And this also goes into a little bit about the prevention of laminitis as well. So we want to look at some of the key risk factors related to horses that do have laminitis, and those, of course, 100% is our insulin resistant horses, our horses with equine metabolic syndrome. And the best way for you to diagnose that in your pony, and I'd recommend that you all do this, because honestly, once you know that your horse has got it, then you're going to be much more inclined to do the work and take that extra little bit of care to prevent them from being put into situations where they're going to be at risk. So basically, the main test that we use for that is an in-feed oral glucose test. What we do with that, your vet will need to come and pull a blood, but the night before, basically you put them in a yard, or you put a grazing muzzle on them, make sure that they can't have any food for at least 12 hours. The vet will come the next day. Forget the most important part. You'll feed them a very bland feed, just like some lucerne chaff. You'll put some sugar. The vet will tell you how much sugar you're going to be putting into that food. You can do it by stomach tubing as well, but then that requires a couple of trips by the vet. And then the vet is going to come and take a blood sample about 2 hours after that feed. So it's a really good way, because what we're doing is we're trying to measure how the body is actually spiking with their glucose and their insulin, and if they're actually showing signs for us to say that there is actually a problem. And if we see that, then we can act on it. Some people recommend doing insulin tests and trying to work out what time of day they should be feeding their horse different foods and that sort of stuff. Honestly, that's a lot of work. If you've got time and yeah, by all means do it, but it's not really required. Yeah, I would recommend that you just do the in-feed oral glucose test. Get your vet to sort that out for you, because they will need to come and pull the blood for that, and you can carry on from there. Now, the other thing that we've got to think about is our horse's body condition score. Now, we usually take this body condition score out of 9. 5 is what the ideal is. Well, sitting between 4 and 5 is ideal. We don't want horses to be getting above 5. That lower picture is 9. It's not what you want, definitely not what you want. But if you're starting to see fat deposits anywhere, you know, those little lumpy bits all over your horse, then I would be highly suspicious that they've got insulin resistance. So do the test. Definitely, you want to be keeping your horse at a body condition score of 5 and no more than that. Other risk factors that we see, of course, is the weather conditions. So when it's sunny, when it's warm, when we've had that little bit of rain, that just makes the grass grow, of course. And remember that new fresh spring grass or autumn grass, mind you, because remember this can happen in autumn as well, actually has a high amount of sugars in it. I'll talk about that soon, so hang in there, because I'll go over that a little bit more. Another risk factor that we've got is the pasture, like the type of hay that we're feeding. So remember, if hay's been cut at a time of year that it was, growing really fast and is containing a lot of sugars, again, it might be dangerous for your horse. So it's always a really good idea to get your hay tested, just so you know how much sugar is in it, and you know if you're going to have to maybe even choose a different hay at a different time if your horse is having a little bit of a flare-up. We also have to remember that the time of day that we feed our horses is really important. We often recommend feeding at dawn and at dusk if we're going to do the grazing protocol, restricted grazing protocol for our ponies and horses. And that's because the sugars at that time of the day are a lot lower. You can get into all this photosensitivity discussion, but I won't. But just believe me that if you are going to put your horse on pasture for a little bit of the day, dawn and dusk is the time that you want to do that. You definitely want to take them off during the, from pretty much 9 till 5 is bad time of the day. And it might actually extend out a little bit longer than that. What else have we got here? Hoof condition, I mentioned that before. Right, so let's get into the nitty. What we actually need to do if our horse has a bout of laminitis. Because this is super important, guys. Remember I said about welfare, this is an extremely painful condition. You've got to get onto it really fast. If you notice that your horse has got a bounding pulse, if they're just starting to get a little scratchy in front, you need to get the vet out ASAP. So although I put the vet and farrier at the bottom of this list, it's actually really important to get them sooner rather than later, because you need to get that horse confined straight away. You want to actually make sure that they're not, for 2 reasons, basically. You want to make them confined so that they're actually not doing further damage to themselves. You want to put them on deep bedding that can either be really deep straw or it can be sand. You can dump a load of sand in the corner of a paddock, or you can use, soft ride boots. You can use any of those those pads, those really nice thick gel pads that you can tape on underneath the foot, especially if you've got horses that are in a paddock and you can't get sand or anything like that. The whole idea, though, is to make sure that those ponies have got something soft to stand on, so that they're not putting extra pressure on those legs. Restrict their movement. Now, number one, you're going to have to get some pain relief into them. Now, you will need a vet for that, because all the pain relief that is worthy of even mentioning is all pretty much a veterinary consult. So you will need to get a vet if you haven't got any of this on hand. So that's using things like phenylbutazone, meloxicam, acetaminophen. Get that on into them ASAP. Really, really, really super important to do that. Now, icing the feet. This is, if you get onto it really fast, there's evidence that, and science sort of says, yes, it works really well. The trouble with icing the feet is that we often get to it too late. So if you're right at the very beginning, really quickly get onto it, and it will help. It's not going to do any harm. So cold ice, standing them in a waterway, cool waterway, river, creek, that sort of thing. My granddad used to do that with his horses. So it's those sorts of things are really, really good, just to help with decrease that inflammation, the heat and pain. Now, we've got to restrict access to pasture. Cannot stress this more. You can't starve them, but definitely, you're going to have to restrict their feed. Now, I'll talk about what I recommend for feeding, but definitely need to restrict their feed, and we'll go over that shortly. And I guess the big thing that you all have to do, and this is why I sort of put vet and farrier at the bottom there, not so much, those are the first people that you need to call when you know that your horse has got a laminitic episode. It's actually super, super important that you trim these ponies' feet ASAP. Ideally, and I will actually put myself on the line here and say that every single horse that is having a bout of laminitis requires an x-ray. We don't know what is going on in that bony column, okay? We can think it might not even be laminitis. I've seen cases of horses who we think have got laminitis, and they've actually luxated their whole coffin bone, and it's not laminitis at all. So totally, it's very, very important. Now, I'll also say we've got to remember that horses don't run on their x-rays. So even if there's, and this is more for those chronic types, we might see a horse that has got an x-ray that is terrible. It looks absolutely shocking, but it's sound. So always remember, we've got to look at the horse as well as the x-ray and combine those two before making too many judgments. But it's absolutely important that we do this. Now, I want to talk now about hoof trimming, because that's actually one of the most important things that we can actually do for our horses. So if we look at this diagram, this is an x-ray of a horse with quite severe laminitis. We've got not only an increased degree of rotation that we can see from the hoof wall, which is, at the front of the hoof there, to the pedal bone, but we've also got an issue with the depth and the angle of the pedal bone and the sole where it's hitting the ground, and that palmar angle that is raised as well. So the most important thing that you can do, as I said, is get an x-ray, and then you want to look at, you actually want to have your farrier and vet doing this at the same time. And the best thing about this nowadays, we've got digital x-rays. Gosh, you wouldn't believe, I've been a vet for a while. So I was around in the old days when we had to go back to the clinic, process all those x-rays, and then communicate what we found later into the farrier. And so many people did not want us to come back out to re-x-ray after the farrier had been. It was just a huge, big pain in the ass, annoying problem. But now we don't have that with digital x-rays. So you can have your farrier there, you can have your veterinarian there at the same time. You can take your pre-x-rays. The farrier that can then do a trim, see how he's going. Is he taking enough off? Does he need to take a bit more? And you can x-ray in between. And that's exactly how it needs to be done. And if you have farriers that don't want to do this, I'm just going to put myself on the line here and say that's not a farrier you want to work with. You want a farrier that understands that they haven't got x-ray vision. So it is a situation where they need the help of x-rays. And no one is saying they don't know what they're doing if they can't do that. And pretty much when the farrier is doing their work, you want to make sure that you are realigning that hoof capsule, that pedal bone, so that it's lying with and looking like this. So pretty much got a very small angle, that palmar angle, very, very small, and you're trying to realign that front wall so that they're taking that pressure off the pedal, the tip of that pedal bone. And that's vitally important. Very interesting to know that if anyone has followed Dr. Eleanor Callan, she's an expert in metabolic diseases, endocrine diseases, so insulin resistance, Cushing's, all this sort of thing. And she does a lot of work in this area. And I'll quote directly from her. She said, "I firmly believe if more horses were trimmed correctly and aggressively from the very start of their laminitis, we would see far fewer problems with chronic pain and eventual hoof deformity." Now, I'm no Eleanor Callan, but I have to agree. We stuff this up daily. And why do we stuff it up? Because we don't use x-rays to assist us in letting us know how we're supposed to trim these horses. And I might sound like an old, dirty, old bloody school teacher here or whatever, growly, but it's so important and it's not that hard. It might cost a little bit in the interim, but it's in the long term, it's actually going to help your horse indefinitely. Now, when the farrier is doing the trim, what they're trying to do is they're trying to eliminate any weight bearing on the hoof walls. So we don't want this hoof wall to carry any weight at all. We want the weight to be held on that sole, and we want it to be on the sole, the bars through here, and we want it to be in the frog and the heels, okay? We don't want any weight to be on that wall, because when that happens, you think about it, you've got a bony column pressing down with a wall, on the outside, and all it's going to do is go like that. It's going to push down. So we don't want that to happen. And so many people get this wrong. You need to make sure that we are realigning that pedal bone and we trim that hoof so that that wall is no longer in contact with the ground. Now, a lot of people will have big conniptions and worry about the deep digital flexor tendon. And if I take my little bony thing back again, remember our flexor tendon, actually, can we see? Let me see here. I'm a bit backwards here. Is this one here? It goes all the way down and is attaching into this. Now, a lot of people say that causes that bone to rotate and that we've got to release the pressure on that and we've got to raise those heels. I'll have to say that in my experience, doing that actually does more harm than damage for the vast majority of cases. Many cases don't need that. What we need to do is we actually need to make realignment rather than worry about that deep flexor. Now, can't say it's going to be the case every single time. And that's why it's so important to take x-rays, have your farrier doing it at the same time as the x-rays, and assessing the horse. You know, we've always got to assess the horse. If we do something and the horse is incredibly painful, we have to try something else. It's a physiological system. It doesn't work in absolutes. So yeah, definitely need to think about that, because we don't want to be putting extra pain, these horses to have extra pain. Now I just want to have a quick little talk about prevention, because hopefully no one here has got a horse with laminitis just at the moment and we can get in before it gets too bad. So, as I said earlier, if you haven't tested your pony for equine metabolic syndrome, go and get it done. It's not hard. And while you're there, you can also consider getting tested for Cushing's disease if it's showing any particular signs related to that. It's interesting. A lot of people think these are linked, and, they think it's the Cushing's that's causing a lot of the laminitis. I'd actually say it's probably the opposite. It's the equine metabolic syndrome causing the laminitis, but the horse also has Cushing's. So it's a little bit of a, we've always kind of focused on Cushing's, but I think we need to start to focus a little bit more on that insulin resistance. We have to stop grazing 24/7 on these lush, rapidly growing pastures. We need to make sure that we are grazing either in the very early AM or to try and reduce the intake of that really lush, high sugar grass. Use a grazing muzzle. That's, or if you've got the opportunity, lock your ponies up, a little small area, use a grazing muzzle. That's really important. Be really careful you don't starve them. I'm going to put some notes about guidelines of how much you should feed, but don't starve your ponies, because that's just going to lead to a whole nother problem. Sometimes I've had situations where people have locked their ponies up and then they've gone and got hyperlipidemia, which is basically because they're starved, the body releases all this fat into their blood to try and give their body some nutrition. And then we have a whole host of other problems. We start getting problems with the liver, and it can become a very big and very fast downhill slide. So whatever you do, do not starve your ponies. If you've got questions, you can always let us know, give us a message, talk to us. You can always send us an email with what you're doing, and we can help guide you with how much to feed, all that sort of thing, if that would help. So we've got to make sure we've got this food on track, and then we've got to talk about getting your farrier in, making sure those ponies' feet, those horses' feet are regularly trimmed. So, keeping them toe nice and short, making sure that you haven't got extra heel, just normal mechanical situation there. And exercise. When your ponies or your horses haven't got laminitis, exercise absolutely helps in so many ways. So what you need to do is if it's ponies and they're ridden by children, as I said earlier, not very many children ride them hard enough, even if they're riding them every day. So mum and dad, I'm going to give you a new job, or it might be your child still, but twice a day, get out there and lunge them as well. Give them, a 20-minute lunge. Go hard, get a sweat up, make sure they're working. Honestly, exercise as well as food is going to help these ponies so much. Now, We will talk a little bit more shortly about what to do if you have a laminitic horse and you need to exercise, what you need to do there. So carry on listening for that one. So nutrition. The main problem with laminitis, if you haven't already guessed, it's that spring grass. And the spring grass is really high in moisture, high in protein, and high in non-structural carbohydrates. And you might see this written as NSC. N for Nancy, S for Sarah, C for cat. So, and those are really high in sugars and fibers. And what that can do is twofold. One, too much of that right without them being even used to it or anything can put the hind gut into absolute chaos. So remember, we've got all those little microbes in our hind gut, and when we get all this sugary, sweet crack of grass, then basically it rushes through all that small intestine where it would normally be absorbed and hones into the hind gut where it destroys these gut microbes, and the microbes are like, oh, what's going on here? We've got sugar. We don't never normally have sugar. So we start to get issues with that. And then so we've got that. So we need to sort of adapt our horses to getting, all this feed. Now, if you're living somewhere, I come from New Zealand, everyone's got grass, amazing grass. There's a lot of dairy farmers out there that have horses and the kids have the ponies. It can be a nightmare. So if you're in those sorts of situations, then your horse is going to have to live pretty much in a dirt yard, and you're only going to be able to give them a little bit. So 15 minutes of grazing. Now, it's always a good idea if you've actually got ponies which you're only giving a little bit of grazing to, give it to them just before you go riding, because then they've got a full tummy. And remember, that's going to help. When I say a full tummy, you've got some fiber in that gut so that when you go riding, the splash effect is not going to, of all that acid, is not going to be doing so much damage. So we're thinking about ulcers there and that sort of stuff. Look, we don't normally, a lot of people don't recognize ulcers in ponies, but it can happen. So it's also a double whammy. It can help with that too. So yeah, give it make sure they're riding, give it about 15 minutes before they're riding, so that can help there. The other thing I always recommend is that you actually test your hay. It's incredibly important, especially because if we had a really good season, it might be that the grass is growing really quickly. We've had some really great weather, and the hay that's been cut is really high in sugar. So you're not going to know that unless you test it. So it's quite an easy thing to do. You basically, every time you get a new lot of hay, you just send a sample in. Lots of the companies like Elders, that sort of thing, they will have a facility there that might be able to do that for you. So it's not difficult, and it makes things a lot better in the long term if you know exactly what you're giving. So feeding recommendations. Most ponies need to lose weight, so that's why I've put feed 1.5% of their body weight. Now, whether it's much easier to know this when we're feeding hay, so this is mainly you feed 1.5% of body weight in general, but I'm talking about hay at this stage because most of these ponies don't need anything else. They need to lose weight, so give them, like your 300 kg pony, or he's only going to need 4.5 kgs of hay. Super important that you use scales. Don't think in volume, think in weight. So you might have to go and buy yourself some scales. Seriously, it's your best investment. Always weigh your hay dry, otherwise you're going to be having water weight there. So do that. Now, the other thing is I always recommend that, and in particular, if we're feeding hay that we are soaking. So remember, we soak hay to remove the sugars. So the sugars will actually leach out of the hay into the water to do that. And so that means that we can drop the sugar content of our hay quite drastically, which will help for all of this. So the idea behind that as well is that the more water you use, the better, because it gives there's more volume for it to be able to leach out into. Also, the longer you can leach the hay or soak the hay, the better. So ideal is to do it overnight. Get your hay ready, weigh it, then put it into the water, soak overnight and feed the next day. Most ponies don't care if they're having wet feed. Like they don't. And if they do, well, you're going to have to dry it again, and you're going to, don't keep it clumped up. You'll have to spread it out on a table or something in the sun. And then it becomes a bit of a hassle if you're having to do that because it blows away. But most ponies don't care too much at all. Give it to them wet. Now, because you're leaching the sugars out, you actually leach out a little bit of the vitamins and minerals that you find in the hay. So you do need to consider using a ration balancer so that the horse is still getting those vital vitamins and minerals. There are plenty of those on the market, and so we won't go into that here. And the other things to think about is you could also consider the types of hay that you're feeding. So the lowest in sugars are your Rhodes hay, your teff hay. Lucerne is also very low in sugar, but just remember, if you're feeding lucerne, then you've got a calcium phosphorus ratio issue there where it's about 4-1 in lucerne, and we really only want 2-1. So ideally, you're not going to make up the full diet. If you want to use lucerne, don't make up the full diet with it. Make it 70% a grass hay, maybe 30% a lucerne hay. You just got to be a little bit careful with that. Definitely talk to either us or your vet about what your horse's individual needs are. So these are just rough guidelines, and each horse is different, of course, but that's an idea for you there. Let's have a little chat about exercise. So as I said before, if your horse hasn't got, or your pony hasn't got laminitis, go hard. Like, you need to do a lot of exercise with your horse. It's going to make it much easier to keep insulin resistance at bay. It's just like us, the more we can exercise, the better. So because it does help regulate sugars in the blood. Now, the other thing to do though is when we're discussing exercise in the horse that's actually got laminitis. As I said earlier, if they've got a bout of laminitis, then you need to stop doing everything. You shouldn't be exercising these horses at all. However, once they've got over their pain threshold, not over their pain threshold, they've got over the pain and they're feeling better, they're maybe not on bute anymore or any of the other medications that you might need to give them, then yes, you can start exercising again. And it might be just a slow walk, hand walking to start with. Just take it slowly. Let the horse tell you. If you notice that they're starting to get sore again, then you're going to have to reassess how much you're doing. Put them in a smaller yard, a bigger yard, so that they can get some free turnout and they can start doing that. If you are going to exercise them, put them in little booties so that you're offering more protection for that sole. You want to keep them comfortable. These horses don't need, the vast majority of them don't need fancy shoes. They don't need anything like that. They just need to have some good contact with the ground, but they need that to be protected. And we want, as I said earlier, we want them to be using their feet properly. If you start noticing that they're walking on their tippy toes a little bit, you need to get your farrier back ASAP, get your x-ray, get your vet in to take some x-rays and assess that alignment. because you want them to be, remember, horses should always walk heel first. And it doesn't look like that, of course. That's way exaggeration, but you definitely want them to be walking heel first. You don't want them walking on their tippy toes. I've got some, yes, Amanda, 100%. Very important topic now as we head into spring. Oh gosh, yes. So Amanda's obviously a vet as well. Hi Amanda, hope you've enjoyed this one. But yeah, definitely it's rife at the moment. So condition score of 5 is where we're at. We don't want to have horses that are overweight. Look, it's just like us, obesity kills. And we've got the same situation here with horses. So if you're seeing those, fat lumps and areas over that crest, over the rump, often they get big dimply areas, like, you can just grab them. Those are all signs that your horse definitely needs to lose some weight. So get back, start with the diet. So, that you'd only need to feed them 1.5% of body weight. Now, if you've got a skinny horse and it's got laminitis, then you're going to probably need to feed a bit more than that. So definitely, like normal was about 2%. If you've got skinny horses, talk to your vet, because it is a little bit trickier. We do, generally speaking though, the skinny horses aren't affected by these metabolic issues. So feeding them isn't as difficult as it is these ponies. So, but we can just keep them off grains and anything with the high starch content. Okay, so Mix and Tracy have asked a question and half of it's got cut off. So the question is, after a bout of laminitis and 12 months hoof growth, does the hoof structure itself return to a state of normal, or is there always a retained change? Really good question. So there's always going to be structural change inside there. Now, we can often have better signs on x-rays, so we can get a horse who looks like it's rotated and it has all those issues, and we can realign it and we can get those x-rays looking a lot better in a lot of cases. But there's always going to be, if we were to, and I know this sounds awful, but if we were to cut open, that horse and slice its leg like this so that we can see how it is, there will always be a wider area in this lamellar area, and that area will always be wider. It will always be prone to more laminitic episodes. Does it mean it's ever going to have one if you are spot on in your care of that horse? No. And I've even found that horses that have severe x-rays might not even be lame. So, and they can actually do a very good job with whatever they have to do. So, as I said earlier, you might have missed this. X-rays are very, very useful, but you've also got to look at the horse, because horses don't run on their x-rays, and we've got to make sure that we're actually assessing both in combination. Ah, that's lovely. Thanks, Amanda. Glad you enjoyed it. Thank you. Yeah, if anyone has questions they want to ask in the future, as I said at the beginning, we always do a free-for-all on the first Tuesday of every month, same time. So if you have any questions, you can keep them for then or send me an email. And no worries. Thanks, guys. I'm glad you enjoyed it. The email, if you've got questions that you'd like to have included so that you can just come back at any other time to listen to the segment, is customercare@yourvetonline. And those will be answered there. Otherwise, enjoy your Tuesday, everyone.